This is again our final of this year. We'll do it again next year. Webinar on the release of Vital Signs 19, but we do have 2020 data that we're going to show you, which we normally don't do, but we are doing it now, just given the situation that we're all in. And in some ways, you know, children, family health, education and youth, arts and culture, like this was our pandemic. These were the issues that we all cared about during, you know, the COVID-19 pandemic that we all kind of just suffered through in the last year. And so there's some obviously challenging things to talk about, but then there's also some good news, which hopefully will be something that you take away from this session today. And just so you know that we are recording, and here is who you guys are. Thanks again for being with us. And good to see so many faces. Wish we could do this in person, but maybe sometime soon. All right, so for those that don't know who we are, oops, where did I go? We are the Baltimore Neighborhood Indicators Alliance. We're at the University of Baltimore. We're a self-support unit within the business school. And we are here to try and integrate data from a variety of different sources and put them in the hands of community members like you. And we're a learning network. We're part of a learning network called the National Neighborhood Indicators Partnership, which is 30 cities around the country. And if you are interested in similar resources in other cities, the link is there for you to take a look at, the neighborhoodindicators.org. So what's the plan for Vital Signs? Hopefully, if this is your first time with us this year on our webinars, we normally have a 16-month lag. When we put out data, we take it for the whole year. So at the end of the year, December, we'll kind of put out the data the following spring, and that takes about a 16-month lag to get everything for the whole year. So a lot of the indicators that you're going to see, the latest available year is still 2019. For example, all of our census related figures from the American Community Survey. But we know that in 2020, there's just so many things that we needed to know right now. So when we have data for 2020, we are attempting to release it. And these are the ones that we're going to be releasing today. All of our other chapters have some 2020 data as well. But obviously this is all in the context of the pandemic. And so up until this point, we were kind of working on things that, you know, tangentially affected like people that lost work because of the pandemic, or, you know, crime that might have actually reduced during the pandemic. But today we're obviously talking about health. And even though we don't have COVID-19 cases by CSA, we do have other resources that I want to show you, but you know, just taking a moment to reflect on what we've all been through. More than 50,000 cases were reported to date, not just in 2020, but to date in Baltimore, and we've all suffered through, you know, more than 1,100 deaths in the city, and so sobering moment. And hopefully we're seeing the light at the end of that tunnel. But just to let you know that we are trying to get data for COVID-19 specifically in combination with our health department. And I do also want to mention that a lot of the data that you're going to see in these chapters in particular requires extreme coordination and relationship building with a variety of different sources. And to those of you that are on the call that provide us data, we are super grateful. And we know that this was a very challenging year. Routine data requests that we normally get pretty quickly took a very long time because there were so many other things going on this year. So there's things that we didn't get, but we're going to keep moving forward. And whenever we do get it, we'll be able to issue it now that we have a platform. Specifically for COVID-19, if you haven't seen our coronavirus hub yet, I'm not gonna do a demo up front, but maybe towards the end we can do that. But this is a resource that's updated daily that shows where cases have occurred and where the vital signs indicators are behind them to show the community context for where cases are occurring. So take a look at the coronavirus hub at any point for more up-to-date information specifically around the pandemic. But today we're going to be talking about Vital Signs 19. And The 3 chapters that we're releasing today: education and youth, children and family health, and arts and culture. And again, like I mentioned, this is kind of at the heart of what we've all kind of suffered through in the last year. So now all of the chapters are available. All the other 5 were released over the last 2 months. And my staff is very happy to finally get some sleep, and hopefully they'll be able to do that after today. All of the story maps are interactive, so when you read a narrative, depending on how you want to access the information, you can kind of read what the latest issues were and actually have interactivity with reading and looking at the data simultaneously. And I'm going to give a demo on how to do that. And the other exciting thing is that every single one of our services are now directly connected to the city's open data portal automatically. So if Cheryl puts something up today, it's automatically on Open Baltimore, and that's really an amazing moment for Binya, for Cheryl, for the city, so that no matter who's accessing data, they'll be able to get it no matter what, whatever avenue or pathway they come into the data portal, it'll work for you. So today we're going to be talking about health and arts, and I'm just going to give a quick overview of what we've seen in the current list, and education. So I'm not going to talk about all of the indicators, but I'm talk about a few. Talk about elevated blood levels, talk about teen births, and a new indicator, which is SNAP. And then in arts, there's lots to talk about, but I am going to talk about the library just because of everything that they provided to us as a city during the pandemic. And Jennifer Mange is on the call, so hello, Jennifer. And I did that even before I saw you, so that's a good thing. And then indicators in education, we have plenty, but I want to talk about just a few, about this idea of how many kids switch schools during the school year, as well as students that are Hispanic, and we'll see some changes there. So all of those indicators that are listed here are now available on our website. So we just issued, whatever, 50 new indicators today. But today we're only going to talk about a few just to get you a flavor of how to look at some of these data to basically tell the story. That's what the data is here for us all to collectively use this information to tell the story of Baltimore. And here's some ways to do that. So like I mentioned, we had a very difficult health year, obviously due to the pandemic, but in some ways, our health chapter shows us the power of what we can do when we come together and actually try to solve problems. Back in 2000, when the Binya Project was first created, teen birth rates were a big issue for our neighborhoods. And back in the early 2000s, this is going back to 2010, but if you did go all the way back to 2000, teen births were closer to 100 per thousand, which today seems unbelievable. 100 per thousand teens had births in the early 2000s. And today that number is down to 20. Now, between 2000 and 2019, so many things happened. There was no one silver bullet to kind of get at this kind of trend line. But, Be More for Healthy Babies, to really look at prenatal care, so many more educational opportunities for girls in particular in the city so that there are other things to do. So many issues around, mobility and housing and safety and things like that, that I think that all of those combined, what I think the Binya Project and the Vital Signs tells us is that collectively we can actually move the needle on things that we genuinely care about. And teen birth rates and a lot of birth outcomes in particular is a good example of how we were able to do that. And then you can see kind of some of these neighborhoods. This is an interactive capability on our website. You can see how some of neighborhoods in particular saw huge declines in teenage birth rates over the last decade. The other kind of positive news is the elevated blood levels. For those of us that were in Baltimore at the time, this was a huge problem in so many neighborhoods. And just the fact of tracking it and starting to test, we can see a dramatic decline in the number of children that are testing positive for elevated blood levels. A lot of education around it, a lot of monitoring, and of course the testing, and a lot of remediation happening in our housing stock to prevent children from being near, hate essentially in their own homes that had lead in it. We still have some neighborhoods, Madison East End just being kind of the one that showed up. And then we have some neighborhoods where we're getting 0 reporting. And this is more about, hopefully this is true, that there truly are 0 children here that were tested. But we do know that we want to go back to the source. And in this case, the source is the Maryland Department of Environment that collects this data. And we do need to kind of maybe work backwards and make sure that their data is more accurate for Baltimore City. It does seem like there's a lot of missing data for Baltimore. So we do want to kind of go back to the source and work with our state agencies to make sure that we can get more accurate information so that we can keep track. But what we have so far is that we see a dramatic decline in blood levels. And I feel like we should all get up and do a happy dance right now. This is huge news for us as a city, that we can keep track of something that we cared about and see the results. So pat on the back for all of us here in Baltimore. We have a new indicator this year, and this is persons that are on on supplemental nutrition assistance program, we know was such a big relief for people in the city during COVID-19. This goes to 2019 data, and we get this directly from the Maryland Department of Human Resources. So this is not census data, which is survey self-reporting. This is actual cases. We can see now, this is the first time that we're reporting it, that about 6.3% of all Baltimoreans had a SNAP card. And you can see where this pattern of high uptake of SNAP. Now, for those of you that may or may not be familiar with Baltimore, we're going to see this pattern over and over and over and over again, especially when we're talking about indicators of stress, of distress maybe, of vulnerability. And this is what Dr. Lawrence Brown calls the wings of the city, right? The west part of the city and the eastern part of the city, and then coming down a little bit. These are vulnerable neighborhoods for a variety of different indicators, and unfortunately, even though we have a brand new indicator, it's showing vulnerability for food insecurity as well. So like I mentioned, this is probably one of our favorite indicators. Whenever anybody asks me what my favorite indicator is, it's the rate of library cards in your neighborhood, how many people have a library card. And in this fiscal year, this is fiscal year 2020, so it includes July 2019 all the way to June 2020. In August, the library, in August of 2019, which is a little prescient, I guess, the library had initiated something called a digital card, an e-card only, so that people would have access to digital resources, but with that same card, they would not have access to physical resources. I got muted. Sorry, as you can imagine, having access to digital resources during the pandemic was critical for people because you couldn't go to the library, especially for the first couple of weeks after the stay-at-home orders began. The library is normally a place where people access the internet, and so I know that the library did so many things to provide hotspots externally to the community, to actually provide spaces, not just in Baltimore City, but in Baltimore County, where people could sit in the parking lot of the library and actually access the Wi-Fi. Lots of good and bad stories about that. It's sad that we had to do it, but good that it was there. And then you can see the pattern of where people have uptake of a library card. So the way that it works is that if you had an e-card, you would have that if you didn't have a regular Pratt card, but you can convert that e-card to a regular card if you did want to get physical resources now that the library is back open. So that's a good news that we had this data set to show where people had a library card, and you can see kind of the pattern. And what's interesting is, remember, you only need one kind of Maryland card, public library card. And you can see out on this western side, even though we do have library branches, Pratt library branches, you can see around the edges of the city, we seem to have lower uptake of a Pratt card, but that doesn't necessarily mean they don't have a public library card, but they might have gotten the Baltimore County Public Library System card to access the county's card. We don't know. Now on to education. So even though we talk a lot about different measures of education like attendance and school test scores and things like that, one of the things that we found here in the vital signs report is that school switching tends to be one of the most highly correlated indicators to stress of a neighborhood itself. Because school switching means that the student has switched within the same school year to a different school. And what does that mean? Is that, it's a new teacher, a new relationship that that student has to build with the teachers, a new relationship that they have to build with the student body potentially, and then possibly new commuting routes, going to a new school with a different pathway that may or may not be a good thing. So just the act of switching is just very disruptive, even if it's to potentially quote unquote better school. The act of switching in the middle of the school year is highly disruptive for the student and to the classroom too. And so notice, again, this pattern of where school switching is happening, because school switching must be something going on in the household where a switch in the middle of the year becomes necessary. Possibly, a switch in housing, possibly a switch in employment, something like that. But you can see where we're seeing the school switching is unfortunately in that same wings of the city pattern. And then the last one that I'm going to show for now before I do a demo of the website is just the increase in Hispanic population within the student body. You can see back in, just in the last 10 years, we've almost tripled the percentage of students in the school system as a whole who are Hispanic. And then in some neighborhoods, over 80% of the students that go to the public school system are actually Hispanic. This is Orangeville, East Highlandtown on the east side of town. Brooklyn, Curtis Bay, which is in the south, is hitting close to 30. And then we have some neighborhoods where there's practically none, which is areas like Edmondson Village. So for some of our schools, adjusting and transitioning to a Hispanic speaking or Spanish speaking population within the student body with, potentially other issues like immigration, refugee status, that's something that some of these schools are having to deal with because of the rise of Hispanic populations in our school system. All right, so I am going to go to the chat and answer questions while I do the demo, try to do both at the same time. But for all of you, what's coming up? Baltimore Data Week is coming up in July, where we are right now crafting what we want to talk about during Baltimore Data Week. So if you stay on this call, you can join us starting at 2:30 for a community brainstorming session, which is coming up next. And that'll be very interactive, not just me talking. And then I do want to give you a demo. And our website is bniajfi.org. And I will stop sharing. And if there was anything in the chat that I should answer, let me know.
Yeah, we just